It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show.
Well, folks, what do we know about the health insurance plan that President Obama is trying to push through in Congress? We're going to learn some interesting facts today. My guest is Dr. Victor Greco, no stranger to anyone in the state of Pennsylvania. He was the former Deputy Secretary of Health in the state of Pennsylvania. He was also a former president of the State Medical Society, and interesting enough, he was the only physician in the state of Pennsylvania that President Clinton put on the health committee. Today, we're going to talk about the Obama plan, and I'd like to welcome my good friend, Dr. Greco. Vic, nice to have you.
Thank you, Sam. It's my pleasure always to be with you and on your programs.
Well, you know, you never cease to amaze me because you're always on top of things. You're going a mile a minute, and gosh, I don't know, like my wife said to me one day, what do you want to be when you grow up? You know, we just keep on going.
Absolutely.
This is an interesting and very serious matter, this health insurance plan, Vic. You were on our news and you made a couple of comments, and I thought it would be interesting for you to fully discuss what you've learned, and I understand you also have downloaded the 1,000 pages of the health program.
Yes,
what are your feelings about the Obama plan?
I think it's, I may use a pun, it's an abomination. I think what they're doing is trying to bring into America socialized medicine. They can say anything they want, but they're going to have to socialize medicine. And as you and I were discussing earlier, this is not a total surprise. Because when he was running, he told the American public that one of the planks of his platform was that he was going to redistribute the wealth in America. And that's right out of Marx's book on socialism. And what he intends to do, he's claiming there are a lot of uninsured people in America. He's playing with words. There are a lot of uninsured people in America, but these are people that either have their own private insurance, don't want their insurance and can pay for it themselves, or the young people who are healthy and feel they don't need insurance. And so when you take those numbers out of the total number he's quoting, you'll find there's probably about maybe 10 to 15% of the population does not have insurance who need it. And as I said on the interview we had, why not concentrate on those people that need the coverage? And rather than try to spread his type of insurance or socialized care, ration care, on the entire population of America. It doesn't make sense. It's more economically feasible, and it's a better project to insure those who really need it. And that can be done at a lot less cost. And I think that once we get in discussing the plan, you'll see a lot of defects that are there. I think it comes down to basically, Sam, basic economics. You can either decrease the amount of money you're going to expend on a project by doing one of several things. One is you ration the amount you put out there. And this is big in his plan, ration care.
Explain that, Victor.
Ration care means that a commission that he's going to set up, and this again is not unusual for politicians. If they don't want to take the heat for something they're doing, they form a committee or call it a commission. The commission will then decide the following things. One is, at what age will they stop allowing people to have replacements of joints? Hip, knee, shoulder, whatever it is. Now, let us say they will do what other countries have done, and that is at age 65 to 70, after that age, you don't get a replacement because they feel you're no longer contributing to society. And therefore, why waste tax dollars on you?
You got it. Yep, you got it.
Secondly, something as important as dialysis. Mm-hmm. And with the tremendous increase right now of diabetes in our population, we know that a lot of these people are going to have kidney disease. They're going to stop end care dialysis, which means in the last year or two of your, quote, life, you cannot get kidney dialysis. So what does this do? It does two things. One is it saves the expense of dialysis, but even, and I hate to be cynical about it, you kill off those people in need of medicine. So again, you're rationing it. Thirdly, when it comes to end-of-life care, and we'll touch on this later on if you wish, in end-of-life care, and this is extremely important to senior citizens, they will decide when you will no longer need treatment. Now let us take an important thing like heart problems, stenting, valve replacements. What they will do and what they have done in other countries is set an arbitrary date or year. Once you're 65 or 68 years of age, no longer will you be stented or have valve replacement because we'll treat you medically. Well, we know that most of the stenting and valve replacements are done between the ages of 50 and 65 and 70. And so again, you're rationing that care. Now, how well do they ration care? They ration care by saying that, okay, these are the guidelines we will let you follow to get this care. Once you need surgery, say for coronary occlusion, catheterization, valve replacement, whatever it might be, you go on a waiting list. Now, I could spout example after example of what's happened. In Canada, where this is being utilized, there were a few people I knew personally that were put on this list. They were told 6 months from now you'll have the surgery. 2 of them died before the 6 months. This is rationing care. Americans should insist on several things. They should insist on, one, carrying the insurance that they want to carry, number one. Number two, those senior citizens out there that are being covered by Medicare, insist on your Medicare insurance that you now have, and to have free access to any physician you want to go to. And if you have to see a specialist, any specialist you want to go to. There's another thing that we've got to do. We've got to realize that if this plan goes through, you will also have difficulty seeing a primary care physician who's going to channel everybody. Not because they don't want to, but their office will be so jammed, their list be so long, it's going to take you a while to get your primary care appointment. Now, what they're going to do, and I am not being critical, because God knows I helped set up the physician's assistant program up at King's, which is one of the best in the country at the time and still is. And the physician's assistants do a fantastic job, as do the nurse practitioners. What's going to happen in order to spread this out, you're now going to have the primary care deliverer being the physician assistant and nurse practitioners. And you may or may not get to see the doctor. Now, be it as it may, no matter how good they are, there's still something that a doctor knows that these people don't. And when there's a difficult case, I'd rather be put in the hands of a doctor, in spite of the fact I love the PAs and the nurse practitioners. I think you understand. Yes. I'm not downsizing or demeaning what they do. They do an excellent job. So again, you're getting care which is rationed. You're getting delayed care, which is a form of rationing. The next thing they're going to do is they're going to begin cutting the cost, the charges, or cutting the fees to the physicians. Now, once they begin cutting fees to the physicians, this again is a way of saving money, which is the second leg on the stool. Less care, less money. Now, who's going to be hurt by this? The people going to be hurt by this is, first of all, people who need care and cannot afford it. Why do I say that? Because as we've seen happen in countries where this type of medical care has been in place, there will always be those people who can afford their care. And you and I were talking about this earlier. And if you want to go see this doctor, you'll take the cash out, put it on a table, and be seen immediately and be taken care of immediately. Also in this area, we've got to be very concerned, because with the decrease in reimbursement of hospitals, the rural hospitals will be hurt the most. We're a rural area. Whether we like to believe that at all or not, we're still a rural area. And therefore, the reimbursement to the hospitals will be cut and keep getting cut so that they can no longer stay in business. What'll happen? Hospital will close. Now you've got to go to a larger institution. Again, waiting list. What happens at a waiting list? Rationing of care, less care.